So I guess for some people, cold sores are a way of life. Fortunately, I don't get them a whole lot. But what's going on with cold sores and laser treatment? I know you want to talk about that, and I'm like, what?
All right, so Randy, I'm going to teach Randy all about cold sores. Tell him about lasers. He asked a question about how long does it take to learn how to use a laser. Not long.
Not long at all.
How long does it take to learn how to turn on a flashlight is really what we're talking about. So, cold sores. Practically everyone on the planet has what's called the cold sore virus, herpes virus. There's simplex 1, simplex 2. It's just location of the body, how they get the simplex 1 or 2. Herpes simplex 1 is the mouth, all right, or the perioral, meaning around the mouth. The immune system that you have, if it can, what we call, take care of the viral contaminant in your body, it never expresses itself, okay? If your immune system does not do that, that's when you get the cold sore. Most people that get cold sores, maybe 4 times a year. Weather change, they don't feel well, stress, maybe they had, in some cases, a skin treatment, laser treatment, because they want to do wrinkles or they have acne and they're taking care of that. That'll bring that on. So,
okay.
Anyway, say you're the regular garden variety patient that has cold sore and it pops up right on the top of your lip. The laser seeks water, which is bacteria, inflammation, and viruses.
So it's drawn into that cold sore.
So we point that laser non-contact, which means we're not touching it.
Okay.
And we hold it. There's 2 kinds. I prefer the CO2, but there's also a diode. A diode's a lower intensity. It can be contact laser, non-contact laser, but we just hold it back a little bit. In about a minute, you feel the heat. What it's doing is decontaminating the area. So where that lesion starts, it starts with a bubble, or you can feel a tingle. When you feel the tingle, you come on in. About 2 minutes later, we turn this on and we run it around there. It evaporates the water that's in the viral nerve ending, which is called the cranial nerve 5, that goes to your upper lip, lower lip. Kind of has 3 branches. We laser that. Once we laser that, the research is saying is that cold sore doesn't come back in that area. You could get a cold sore on the other side.
Okay.
But that's what it does.
So it's kind of it's solving a cold sore in one place for
one quick zap. It's as simple as that.
Oh, hey, one other question. I asked this before, but just for the. And how do you avoid not blowing somebody through their head with a laser, not going all the way through the... Just want to be sure about this. We're talking lasers now.
So you got to have a little aim skill here, but the machines are calibrated to cut at a certain depth, which is about 1/10 of a millimeter. 1/10 of a millimeter, not 1/10 of an inch. I mean, we're talking microns.
So as you're going to that cold sore, it's just a little bit of the
thickness of a hair. How about just put it that way? All right, and it will not burn a hole through your lip unless I continuously up the power and the amount of time. So if I went in there for like an hour,
okay,
it's going to zap and make a hole in your lip. We're not doing that.
No, don't do that.
We certainly will take care of the cold sore. And non-Novocaine procedure, it does not hurt. It zaps the viral contaminant. It lases the end of the nerve ending, which is cranial nerve 5.
Is the cold sore gone when they're out, or is it still?
No. What you're going to see is sometimes you'll see it like, I use the term pop.
Okay.
Caramelize. It's not doing any of that.
Sounds delicious, but go on.
What you're doing is you see the plume of smoke coming up. It's eliminating the water contaminant that's contaminated. Then it singes over the lymphatics, the capillaries, and the nerve endings.
So then how long after that until it's like never even knew you ever had a cold sore?
So if you just let your cold sore go and you didn't do anything, it's about a little more than 2 weeks.
Okay.
Some people get really bad and it goes up like into the inside of their nose. Those are the bad ones. By using the laser, we can minimize that to about 3 to 5 days.
Oh, that's much better.
So, and then it's almost cured at that point. So I laser you, or whoever has a cold sore, 3 to 5 days later, they're fine.
So if I have a date tonight, you can't really, totally help me. But if my date is, it's Monday and my date's on Friday,
think you'll be okay.
Okay, that's great. Well, hey, if you've got that situation, first of all, good luck. Good luck on your date. Second of all, I think you want to call Dr. Bilski, and he can take care of that cold sore for you.
Sure.
And hey, there's always great videos just like this, and you'll see them at bilskidental.com. So be sure to watch a few more. Thanks again, Dr. Bilski.
Thank you.